This patient was referred to me for endodontic retreatment of tooth number 14. According to the patient, the root canal was done by an endodontist approximately 7 years ago. Recently, tooth started to hurt. He went and saw his dentist and was referred to us for examination, evaluation of tooth number 14 with endodontic retreatment of the tooth. So let's analyze this tooth. Porcelain crown here, you can see previous root canal, prefab metal post here, and there is a nice size periapical lucency associated with the buccal and mesial, so mesiobuccal canals of this tooth. Distal buccal is clean, palatal is clean, but just the MB root, and you can see the outline of this periapical lucency here. Let's look at a different angulation PA. This is a different angulation, and again you can see the distal buccal is clean, palatal is clean, and the problem is right here on the mesiobuccal. Take a look here. Again, this root canal was done according to the patient by an endodontist, and look what happened here. It looks like there is a ledge here. So this endodontist created a ledge, and then he couldn't go to the end, to the working length of the MB1 canal, as you can see. So that's a ledge right here, and I confirmed that clinically as well. And the way I confirmed it is when I was trying to instrument, my instruments would go to here. The instruments would go to here. And then I needed to create a little bend in the apical 1 millimeter of my C files, and then watch wind, and then it would go to here. And then from here, then I was able to regain patency in the MB1 canal and MB2 canal. There, even my gutta percha, I had to give it a little apical bend, and even with the gutta percha to fit the master gutta percha point, I had to do the same thing, little bend in the apical 1 millimeter of the master gutta percha point, so I can bypass this ledge here and then put it to working length, insert it to working length. Also, take a look here. There was a sinus tract right here on the buccal of tooth number 14. That's number 14, porcelain crown. And that's the sinus tract right there, as you can see, right here. All right. So we discuss options with the patient. Patient's young, in his 20s, and he wanted to, of course, try to save the tooth. So today we went through the porcelain crown here, removed the buildup material. I only worked on MB1, MB2, and distal buccal canals. There was no reason to mess with the palatal canal with this, especially with this huge prefab metal post already in it. As you can see, the palatal canal is clean. All right, so take a look here. Here's the post-op. So as you can see, this was the ledge right here that I was able to bypass, and I was able to regain patency in the MB1 and MB2 canals here. This buccal canal, also I was able to regain patency and instrument, irrigate, activate, and obturate three-dimensionally MB1, MB2 distal buccal canals to desired working lengths. As I said, as you can see again here, palatal canal is clean. But this was the problem right here. The previous endodontist that created a ledge, therefore was not able to go to working length, and he was not as experienced, very likely, as I am with 23 years of experience to be able to bypass. So had to obturate to here previously. So we were able to address all of that. And look at all of this anatomy that we were all able to also pick up. Look at that lateral, right into the lateral lesion there. Look at all of this anatomy here. You can see right here, right here. Everything went beautifully, as you can see. And again, we did this in one appointment, less than an hour. Optimistic that we'll have a positive outcome. I requested that the patient comes back to see me in 6 months, so hopefully he'll show up and I can post the 6-month follow-up for you guys. But this is how we're supposed to be doing root canals, and even as you saw, us endodontists sometimes miss. No excuses, but nobody's perfect. I wish he had done a better job the first time around, so we didn't have to correct a lot of mistakes, and this patient didn't have to suffer and pay for another endodontic retreatment for an endodontic retreatment again. But here it is. Excellent.